Happy to be joined now by Dr. Syed Hussein from Trinity Health of New England, where we talk about the latest health news in our state. Doctor, good to see you again. How are you?
Good to see you too. It's good to be in the main studio.
Yes, you've gotten the upgrade now to the good chairs. Usually around this time we talk about COVID. Want to do it just one more time, but really we're talking about it less because we're seeing less and less stringent measures. New York City is now ending its vaccine mandate for a lot of the municipal employees. What is that saying about at least COVID levels in this general region? Because of course the virus doesn't know state bounds.
So in a nutshell, Tim, I'm not surprised. This has been a trend, and it tells us we're now moving into the endemic phase where we have to coexist with this virus. So I want to take you back to where we got vaccine approval by the FDA and CDC way back in December 2020. Just to remind viewers, at that time we had thousands of people across this country dying alone here, not to mention globally. And then the virus was also unchecked in terms of transmission. So the vaccines have done what they were supposed to do. Yeah. Now as we move into the endemic phase, it's important that folks get vaccinated every year, just like how we do with the flu. Yep. But the mandates will likely go away.
And that's a great reason to keep things where they are right now without another flare-up coming. Moving on, there's a new study out of the United Kingdom that showed that eating ultra-processed foods is associated with a greater risk of developing cancers and dying from them, especially ovarian cancer. So let's talk a little bit more about that. First of all, what do they mean by ultra-processed foods?
So these are industrial ingredients, Tim, such as food additives that are added on to either ice cream or hot dogs, burgers, French fries, canned goods to either increase their longevity or improve their flavor. And these have been now associated with a higher risk of cancer. This is a large study looking at close to 200,000 people, but it adds to a growing body of evidence that ultra-processed foods tend to increase the risk for all sorts of cancers.
Do we know what the mechanism is yet, especially considering we've had a lot of studies that have reached the same conclusion?
So additional research is needed. Most of these studies are observational studies, so there's an association but not a causation that can be proven.
Right.
So more research is definitely needed, but it does also give you an idea of the wider picture. Those, per the study, those that do eat ultra-processed food also tend to have a lower, a less healthier lifestyle.
Right. There's confounding factors here. Right. In other words, you're saying the more likely you are to eat ultra-processed foods, the less healthy you are in general.
Definitely.
That, in turn, could be raising your cancer risk, too. All right, one more thing I wanted to get your opinion on. The CDC recently released new information saying that Black and Hispanic dialysis patients are at a greater risk of dangerous bloodstream infections. What's going on with that?
Yeah, so this tells you some of the things that we've noticed during this pandemic, that some of our minority populations are disadvantaged because there's lack of access to primary care. Ultimately, this leads to uncontrolled medical problems such as hypertension and diabetes, which are among the leading causes for end-stage renal disease in the U.S. Yeah. And so it just goes on to show you, Tim, that there's a lot of work healthcare leaders we need to do in terms of removing some of these disparities in healthcare. And this is why you see a larger proportion of minorities that are impacted.
Is it just a lack of access to the health care, or is it that and also a lack of quality health care? The quality of health care that they are getting when they get it is substandard.
I would say it's mostly to do with access, and also, you know, the onus is on us as healthcare leaders to be able to provide education and do all sorts of outreach for these communities so that they have access to timely care and they don't end up in the hospital when it's too late.
Yeah, a lot of those disparities, as you said, they were there before the pandemic. They've only gotten worse since then, so that is something that we collectively need to do a lot of work on. Doctor, good to see you again.
Thank you, likewise.
A pleasure. Dr. Syed Hussein joining us here in the main studio, because he's here so much. He really is just another part of the broadcast team at this point.